Hello, my name is Jocelyn Guerra, and I'm here to present healthcare access in Texas. For my second slide, I'm going to be talking about critical issues in Texas. So these critical issues are going to be following the healthcare access in Texas. So the first one that I have here is going to be large populations with no insurance. Then the second one that I have is barriers to Medicaid expansion. The third one I have cultural barriers, and the fourth one I have rural health discrepancy. Now I'm going to be talking about large populations of people with no insurance. So as you can see on the graph on your right hand side, there's going to be the number of people that have no insurance in Texas compared to the people who have no insurance overall in the United States. As you can see, the people that live in Texas, the whole line is just way more higher than it should be compared to the average number in the United States. Thus meaning there's more people that are uninsured in Texas, which can lead to a lot of chaos and a lot of bad things. So looking into the stats side of it, Texas is consistently ranked number one in the most uninsured people in the United States as a whole. So our whole state is ranked number one for most uninsured people. More than 4.3 million Texans, including 63,000 children, lack health insurance coverage. And of course, the numbers are going to be fluctuating over the years, as you can tell by the graph. But overall, in 2018, 17% of Texans that were residents, which are approximately 5 million people, had no coverage. And that only went up from there. And then recent estimates indicate that the percentage of Texans without health coverage in 2022 is 16.6%. There are a lot of challenges that you face when you don't have insurance, such as just limited access to preventative care, delayed treatment. If you did so need it, you would get majorly delayed, which can lead to death or just many other medical problems. There's also just financial barriers that you're going to have to face whenever you don't have insurance, which is very sad. Also, for Texas, they actually stopped expanding on the ACA Act, which is the Affordable Care Act, which is also kind of known as Obamacare. And this is aimed to expand health insurance coverage across the nation. But unfortunately, Texas did not expand on that, which means they did not expand on our Medicaid under the ACA. This decision, which just so happened to be by the Texas governors and all that, which really sucks because it just disbands the expansion of Medicaid. So in summary, Texas faces substantial changes related to uninsured population. Addressing the issue requires policy changes, increasing access to affordable health care, and focusing on preventable measures to overall health care outcomes. Okay, going forward on our next slide, I have barriers to Medicaid expansion. So like previously stated, I did go over how Medicaid did not get the expansion that usually in other states they get because due to Obamacare and the ACA. So Texas has chosen not to expand upon Medicaid under that act, and as a result, there exists of a coverage gap for low-income adults. These individuals earn too much to qualify for traditional Medicaid, but fall really short when it comes to the income to actually afford either insurance or just health care overall. So it does make it very hard for them to go to the hospital and pay for it. Essentially, they were caught in a precarious situation where they lack the access to affordable health care coverage. The next bullet point I have is financial impact. Medicaid expansion would refuse federal funds into the state healthcare system. This financial boost would benefit both patients and healthcare providers. Expanding upon Medicaid would also allow approximately 1.4 million low-income adults in Texas to be eligible for the coverage. And for healthcare providers, the influx of federal funds would support hospitals, clinics, and other facilities within that. Then for political and ideology factors, oppositions from Texas Republicans over the years, lawmakers have been consistently opposing Medicaid expansion. In 2015, Governor Abbott stated that Medicaid expansion is wrong for Texas. He characterized the program as already broken and bloated. This perception of the poor also just manages and is completely unstable. Critiques argue that Medicaid expansion would stain the program, leading more poor people to manage and be more financially unstable. And of course, the government has deemed their concerns and the healthcare outcome and crowded out. So within that, there's concerns that expansion would lead to poor health outcomes and potentially crowd out the vulnerable population, such as children and people with disabilities. So in summary, while Medicaid expands, could significantly improve access to healthcare and financial security for Texans, the decision remains super complex and multifaceted, balancing politics, considering financial implications, and well-being of citizens continues to shape the ongoing debate of Medicaid expansion in Texas. In this slide, I'm going to be going over cultural barriers and linguistic barriers. So for overall, I have like 3 topics within this. I have health disparities, which is the first one, in which is health disparities are preventable differences in the burden of a disease, injury, violence, or opportunities to a optimal health that are experienced in social disadvantaged populations. And then next, I have health literacy. This is like the understanding of healthcare. So since Texas does have a very diverse population, the access to get education within the community on healthcare is very limited, and the access to healthcare resources is also very limited. And then you have language services. In Texas, since there's so many diverse people from like Vietnam, Mexico, they just speak a whole bunch of different languages as well. That's what comes with it. Unfortunately, the majority of people that do provide healthcare only speak English, and they do form kind of a stigma against those people who don't speak English because they already are having a hard time with them, which can lead to a lot of mistrust between the patient and the doctor, or per se like nurse. It's just a bad situation overall just because of a miscommunication error. Also, the cultural capacity to understand that culture and be like, oh yes, like this culture doesn't do this, they don't like doing this, it's against that culture. It's just a lot of blockage there overall as well. In this slide, I'm going to be talking about rural healthcare discrepancies. So these discrepancies arise due to a combination of factors, which can be limited access to healthcare, shortage of providers, or just adverse healthcare outcomes. So the first one I said was limited access. This can come in like forms of transportation barriers. There could be a lack of just transportation to get those distances to a healthcare facility. Also, just the distance overall, the geographical distance. Within rural areas, there are going to be more length for people to travel, which can also just be a very sad outcome. So then the next one I have storage of providers. Healthcare physicians are on a shortage as of right now. So these healthcare professionals play a crucial role in prevention of and providing care and early diagnosis and managing just chronic conditions overall. Then you also have a limited access in specialists. So if you're in a rural area, there's not as likely if you're going to have a really good hospital that specializes in something. Overall, you're just going to probably have like one hospital that's just very general. So the access to specialists is very limited. And next, we just have health outcomes. Within this, you have like your chronic diseases, your mental health issues, and then substance abuse. Since there's hardly any specialists, and there's hardly going to be anyone that's going to be there just for mental issues, just to provide that sort of assistance with mental issues or substance abuse. And then even for like chronic diseases, it would be a limited access to prevent this, and there won't be as much screening or just like health education within these disparities. So within all the issues that I just stated, I will be making solutions for them. So the first one I have here is just expanding Medicaid overall. The expansion of Medicaid can provide more aid and just help low-income families just get more coverage and reduce the number of uninsured people in Texas. The next one I have is to invest in rural healthcare populations. So expanding within like a mobile clinic or even just something called a telehealth center will aid more people in rural areas to get more healthcare that they deserve. The next one I have is just community outreach and education. The more that you can reach out to people, the more you can educate them and just communicate with them overall within Texas, within their own language or just culture or anything like that, the more awareness that it would provide for the community. And the next one I have required cultural competency training. So what I would like to make here is just require more training within cultural standards. So basically within cultures, there's different things that they like to celebrate, like to do, or just have within like healthcare. So being like a nurse or anyone that goes into like the medical field, they should be required to go into this training that will just provide information on like what you should do with your patient, just in case like a Jehovah's Witness, I believe they don't like to transfer blood, so just knowing that would be a big help, so it doesn't leave any problems with the patient and the people that are taking care of them. Yeah, so all these solutions I provided just for the issues stated within healthcare access in Texas, which I believe would make Texas a lot better. So for this slide, I'm going to be talking about the criticism and my response towards that. So one criticism that I could see people having about like these solutions or like these problems is just, how will we be able to afford this? The cost is just a big issue. So critiques may state how spending money on new healthcare fractures, and extending Medicaid is expensive and will put a burden on the state's budget. Well, my response to that is just being more cost efficient. So within that, you would analyze your costs, and you would just be able to analyze your budget and see where you can make cuts and where you can improve on, or even just reducing the amount in healthcare items would also just be very beneficial, because the amount for, let's just say, a ride to the hospital is just thousands, which does seem a little chaotic. So I think providing a lower cost towards that would also just help overall in the money situation. Then finally, for my Alexander's question, I would need a up-to-date, thorough information on the success of the compatible programs that are in other states in comparison to Texas of what they're doing now, and financial inclusives of bettering healthcare access, and just real proof of the advantages that communities have reaped from adopting these tactics in order to modify my opinion on the solutions put forth. Furthermore, it would be more impressive to have a more refined and modified suggestions and or just overall remedies that continuously assess and input more impact within the population of Texas.